Welcome to this extra special second bonus episode of A Shot in the Arm podcast at the World Health Assembly. And, well, we are truly exhausted and we are taking this opportunity to actually reflect and take stock with two of my greatest friends, the people I look up to, who've been here working the floor of the UN, I think, for well over a year. We're joined by Chrissy Stegling, who is the Deputy Executive Director of UNAIDS. Chrissy, welcome again to A Shot in the Arm podcast.
Thank you. Happy to be here, Ben.
And fellow friend of the pod, it's Vuyiseka Dubula, who is the head of the Department of Gender, Communities and Rights at the Global Fund to fight AIDS, TB and malaria. And the theme of this podcast is about where HIV sits in the plethora of pandemics that we're dealing with, and particularly given where we've got to with, or not got to with the Pandemics Accord this week. And I guess where I'd want to start, if it's okay, is for both of you. I mean, all three of us are passionate AIDS activists all of our lives, and we've all found ourselves in institutional roles. But I've been hearing this week from a lot of sources that, okay, well, HIV's had its day. You had a good run, you had massive resources for 20 odd years, but, the number of infections, compared to other diseases, it's not so much. So isn't it really time for you to move over and let other diseases have their say? And I've got thoughts about that, as you can imagine, but I'd love to know what you think. Chrissy, do you want to start?
Sure. I think two things on that. I think, one is always to ask ourselves, what do you mean when you say you've had your day? Does that mean HIV doesn't exist anymore? Do we not have 30 or 40 million people living with HIV? Do we not have 1.3 million new infections each year? And do we need to compete? Is 1.3 million new HIV infections worse or less bad than, people getting infected with other diseases? So I think the playing off different diseases against each other is I think, not a good idea. But I think also what is frustrating is that there is a disconnect between what the global conversation is around HIV and what the local and the national conversation is. If you're a country like Botswana, where almost a fifth of your population are living with HIV, HIV hasn't had its day. It is the day of HIV, right? And so my experience this week here was that every single minister of health, and I met many of them that I have spoken to, whether they come from a high-burden country or not, they have very different ideas about what is needed, but they all have a very clear idea that they do need to address HIV. And so for them, it's not about, the day has been and we're doing something else now. It's about how are we addressing HIV in their specific context. If it's a context where you have a huge increase, the Philippines, 411% increase in new infections.
411% increase in the last year?
We're always modeling against, or we're always measuring against 2010. Right?
Oh, okay.
But, very simply, last year, 20 people got infected each day in the Philippines. This year, 50 people get infected each day in the Philippines. That is a reality that a Ministry of Health and a Minister of Health has to think about, right? In the bigger picture of a huge population in the Philippines, this is not a huge group of people, but it's a group of people he needs to pay attention to. It is an infectious disease, right? And he needs to think, how do I integrate and how do I serve these people in my health system? So maybe just to come to an end here, I think, yes, it's about, for most people in most countries where we have HIV epidemics, it still is a reality that they need to address. For some of them, it's an integration question about how do we integrate meaningfully. For some of them, it's how do I deal with an increase in new infections? And for some of them, it's around the structural barriers that they know they need to overcome to do that last mile. You know, the Australians who have just signed off their own policy and statement around, they really want to lead on being one of the first countries where they will get to a point where there are no new HIV infections, right? So HIV is still in each one of those countries. I think the frustrating piece in a context where we've been trying to get to agreement on the pandemic accord is we're talking about pandemics of the future without talking about pandemics that currently exist. Why are we talking about pathogens that we don't know even yet what they look like, when we know that we have still pathogens with us that we know what to do about, what we need to do better, and we need to come to an evolution of how we deal with HIV. So I think, you know, this thing about we are done and what's next, I think it's just not the right way. And I think it's a slight arrogance of a global conversation rather than what is actually happening at country level.
Well, Vu, she's basically covered everything that we were going to talk about in the podcast in that one intervention.
What more for
Should
me
we
to
go
say?
home? And look at a meeting with ministers of health. Oh, we're in company. But I'm also hearing it from the financial side as well. And I just wondered what your take is. You know, Global Fund, AIDS, TB and malaria. There was a talk about whether it was going to be COVID, whether it was going to be health systems as well. And then there's this sense that perhaps, again, why is so much money being spent on HIV? Whereas if we just had a few more million for malaria, we could bring malaria to an end much more rapidly.
I think my starting point is, I think the world has gotten comfortable with doing very little and then gets tired with doing the very little and move on to the next sexier thing. And I use that example because we gotten used to not delivering on the MDGs. We moved to something that sounds very different, which is SDGs. We are not delivering on the SDGs. We're going to find something, another sexy thing. And that sexy thing this time shifts the focus from what we didn't deliver in HIV. In HIV, Chris has already spoken about where there are countries where there's a resurgence of infections and incidences on a daily basis that we still have to manage. Then you have countries that have high prevalence that must maintain the level of management of HIV until we have a cure, which we don't have. And I don't even want to talk about the cure because the cure is part and parcel of the package of managing and controlling HIV. Have we had the day? Third, mortality. Chris spoke about how do we prevent HIV and the incidences. I'm bringing in the management, which includes me. I am on these drugs for life. I'm taking ARVs for life. My state, my country has a responsibility to maintain my health, quality of care for me, not just access to the drugs, but the quality of care, which is not just about the drug. It's about an enabling environment, which includes human rights, an enabling environment by building systems that are resilient to maintain people to receive care in a quality way. Mortality. Why is it, if people are saying, those who are saying it are saying we have had our day, why is it that we still are content with more than 600,000 deaths every day from a disease that all of us know how to manage, what are the things that we need? HIV today, in terms, let me not say HIV, AIDS kills it's still an undercount, more than 600,000 people. I think it's more than that.
What's the annual figure for mortality in HIV globally?
635,000 last year. 2022 with the last year data.
Counted, right.
Counted. But if you follow how many people are disengaging from care from countries who have high burden in terms of prevalence, the numbers are probably higher, because if we are anticipating about 30 to 40% people will leak out of the system for various reasons, those people end up where? In the coffins, because they're not getting services, they're not getting access to care, they're not coming back. If they come back, there's punitive measures. One can also deduce from that some of those people are people who are gay, MSM, sex workers, or the key populations who are already feeling like the health system is punitive and it doesn't provide adequate comprehensive care. coming to financing. I think the Global Fund, whatever happens in the future, should continue maintenance in presence in what it was founded to do. The foundation of the Global Fund was to end, not halfway, to end, meaning right when we have zero in all of these things, ending HIV, TB, and malaria. If there's an expansion of mandate, it must be something where already it is a no-brainer to bring in intersectionality in terms of systems, bringing in the quality of healthcare, bringing in less disruption in care, which will be brought in by climate and health and climate crisis, which has disrupted what happens where we see floods, where we see droughts. It impacts on us ending HIV, TB, and malaria. That for me is a no-brainer to find those intersectionalities. But that does not mean we stop learning by fighting the current pandemics in order to prepare for future pandemics. You can only know by what you've done today, whether you've built resilient systems to withstand what we've seen with COVID, that there are areas that we should have done better, but we only use the lens of learning from what we've done on HIV, TB, and malaria. And we repeated similar mistakes there too, because we also did not bring in communities at the center. In the response, it was driven by the state. And in some states, even in the sustainability and thinking about human fighting or even sustaining the response now, a lot of people are talking about one plan, one budget, one M&E. And one plan is designed by who? What did we learn from the current pandemic, and how do you respond in a multisectoral way? By bringing those who are not in the table to design that plan and that budget at the center. And we've learned from just the current pandemic, which some countries are just getting out of, that by failing to bring those communities who are going to be affected, you will not reach the last mile, or you will not reach the end. Financing is a very difficult space, because I am in Global Fund now. It's everybody is thinking about the one disease over the other. Let's give more malaria, give more TB, and less of, at the end, we are talking about the same person. We know of people in Africa who have had 3 diseases at the same time. Which one do you choose to deal with and not the other? Because one of the 3 diseases will kill someone, and it will kill that person, whether we choose to do TB. For Africa, it will be a blunder, including Asia, to not put focus on HIV and TB, because TB is still the number one killer if we look at mortality. It's killing the very poor. So there is no way that you're going to move money from HIV to TB and think that HIV is still not going to kill people, because the world of HIV and living with HIV is not just one opportunistic infection that will kill you. You'll still be dying of pneumonia because you've neglected to put people on treatment to build their immune system and strength to be able not to get other opportunistic infections. But to close the conversation, we get into the being tired conversation because we are pushed by donors. And the push from donors at this point in time, it's not a push coming genuinely from the fact that there are no pockets. It's shifting priorities driven from the extreme far right, which are very anti-rights, anti-gender equality values, are diminishing anti-democracy. And all of that is about, let's look after our own people and let the rest of the world to die. And that for me is a regression that will take us backwards, because they need the globe to sell their medicines. They need me to take my ARVs to remain in business. So it's not like we are here as receivers. Our states pay for these drugs. Our governments pay. The money that goes to the Global Fund is public taxpayers' money. It's not private sectors only. It's not government only. It's the public that pays. The public must then decide whether it is okay in a world that we live in today to allow others to die from some diseases of the poor, and others will be, one way or another, it will cross the border.
Well, here's the thing. We're talking about pathogens. They don't respect borders.
Oh.
And, you know, I mean, your country, of course, is having elections as we speak. Let's not talk about that. But I remember when, in the middle of COVID, you know, one of the new variants was discovered by South Africa. It shared that information with the world. And what did the world do? It closed its border. You know, countries closed their borders to South Africa. Of course, after the horse had bolted, and in the United States, they found the variant very well established, regardless of what border closures were done. So it seems to me, maybe it's just a final act of desperation by richer countries, that the way we deal with this is to keep all this nastiness away from us and out. But it should sort of be our job to say, it's the whole person health. It's all of us together. It may be refugees tomorrow. It may be people in the Mekong Delta that have to, make a living by catching bats and wild animals, and then perhaps, finding themselves exposed to new infectious agents. And it seems, you talk about regression, it seems we really have lost that sense of, and I don't mean to be wishful thinking about it, but a cold sense of global solidarity that we started to see with the UN General Assembly negotiations on AIDS in 2001. How have we screwed this up? How have you screwed it up, Chrissy?
She wasn't part of that.
Yeah, and I think, it's the world of parallel narratives, right? So we talk a lot about global solidarity and then we don't act. And I think what has gone away a little bit is that sense of urgency. And I think that I would admit, right? It was easier 15 years ago or 20 years ago to create real urgency behind our response to HIV compared to what we have now, right? The numbers are less. We have a lot more people on treatment. We're actually really successful in many ways, right? Which is great. But what we have lost in this is a sense of urgency that brings people together to demand global solidarity. We had done a very bad experience, as Vuyiseka has said, where we didn't see global solidarity during COVID, right? So we hadn't learned, we hadn't replicated what we did with HIV. And I often say that, and I think people forget. It's like people make it sound like we all sat here in 2001. We were all around, right? We were all there when the Global Fund was created. We were there when we changed rules around IP to get medicines accessible to everybody and affordable to everybody. It's not like we sat there and we waited for people to bring this to us. We demanded it.
Right.
So when we sit in conversations now, when people are saying resources are reduced, they are finite, priorities shift, I sit there and I think we shouldn't start by what is available. We need to say what is needed. And that's what should... And we have always done that in the AIDS response. And that's why we have been successful. We have sat there and told people, that is all terribly interesting, all your priorities. Here are our priorities as communities, as member states, and as affected people. So that is, I think, what we have lost a little bit. We have started having all these parallel narratives and have allowed other people to run our narrative for us. And I think what we need to do is we need to go back to basics a little bit to say what is really needed. Where will we get support from, and where do we need to demand support from, and how do we demand that support? And as you say, many of us have moved into institutional roles, me into the UN, Vuyiseka into the Global Fund. We need to redefine those spaces and make sure we don't lose our voice in that, to demand what is needed and not let ourselves be told by others what we should be asking for. And that's why I started with the ministers, right? Because their reality is still that they have a need. And if you come to the UNAIDS space, which is a good space in the UN, we're the only place in the UN where we have communities on our board.
And I presume you're not talking about the building itself.
No, I mean
our
board.
Like something from the Matrix. I mean, you get lost here just by getting in an elevator.
Okay, I have a comment on that. But there are worse buildings in the UN, and I will tell you offline which ones those are. But I think, what we are seeing even in our own board, we see a real demand from countries, especially high-burden countries and countries with resurging infections, telling the world, we need a program on AIDS, we need funding for AIDS, we need X. but a reluctance from the countries that are providing the funding to listen. They listen and they say that's true, but we have a constraint, a financial constraint. So what it will need is for us to really shift this dialogue about what is needed, where will it come from, and not accept that there is less money because our priorities have shifted. And our priorities have shifted because we have so many burning issues now, right? We have climate change, which frightens people. We have a lot of conflicts. We have a lot of people on the move. And some of it, I was saying before we started recording, I was saying to Vuyiseka, one of the things I felt very strongly this week in conversation with people, it kept on coming back to some of the basic questions. For example, women's health. So we talk about HIV and women living with HIV, but we should talk about it in the broader aspect, in the broader context of women's health, right? We're not doing well on women's health. We're not doing well on gender equality, right? And so it's a broader question of integration. How do we integrate our needs into those broader conversations and find also new allies and new friends to make those demands and say, it is not just about HIV. As Vuyiseka is saying, people are not just a person living with HIV. They have other things going on in their life, but also they might have other diseases. But we're cutting people into these different categories and then try to decide how will we serve all these different categories instead of saying, if we're really talking about One Health, if we're really talking about health system strengthening, then we should be saying, with a person in the middle of that person might also be a person living with HIV or a person at risk of getting HIV. How are we serving them? What are our new ways of doing that? So I think there are a lot of ways of changing the narrative, but we're a little bit caught up in our own old narratives and are not managing that.
So going back to the Pandemics Accord and noting that the things that are problematic are around intellectual property and the sharing of information about pathogens. These were things that we fought for with blood, sweat and tears in the early 2000s. It wasn't, it didn't just suddenly happen when generics started manufacturing them. There was a really long effort to get there. Why do you think, Vu, that there's no institutional global health memory about what we did?
I think there is. People refuse to acknowledge that the intellectual property regime needs to fall in the South African way of saying things, needs to fall, meaning dismantle the institution to understand what is needed now, what is the kind of regime needed to take us to, because things are really complex. For example, I'll speak of African countries want local production, but you can only produce when you have active pharmaceutical ingredients in the region. You can't produce when something else has to be imported and taken. You still have to go through these trade-related complex agreements. That means that the institution itself, because we now know it serves certain interests, it's not public interest all the time, it needs to come to a point of recognizing that it is not sustainable to only rely on IP in the same way. Will it change? No, because we know who are the supporters and proponents of maintaining status quo. So Africa needs to think, and many other developing countries in that bloc, to think about what do we need? What is a regional body that will become that regional body to challenge this robustly, as they have done with COVID? They really together, united to fight back on what the North and the West was doing, to say, you wait until we are done with vaccines. When we are done, we are coming for you. We've learned that, and that memory is very quick.
And that sort of, I don't think COVAX meant to do it in quite that way, but that is what happened. We'll let you know when we have extras that you can have.
Yeah.
And it's interesting that was a sort of a Geneva conversation, essentially. And I feel that there is certainly a passion from and a determination from many African countries to say, never again. We're not going to rely on your charity. We will take care of local manufacture or regional manufacture and partnerships ourselves around active pharmaceutical ingredient, which of course comes so much from China and other parts of Asia.
But when you have debt crisis,
Yeah.
when you have, how do you build local production with no money? Because you have upfront money to build capacity, to build research and development in Africa. You need money to do that. And most of the countries have debt crisis. So because one could say, but why are we having this conversation? Because Africans can do this. Okay, they have political will, they can do it. But financing it is another story, because the dependence, because of the environment in which we are living in economically and the debt, the dependence on getting at least just the startup cost for that local production is still, we're having to knock at the same doors who are saying, you have to go in this way, and the IP system will not change, and this is what you have to go. Remember, me and you remember this for the intellectual property and how we challenged it. We were only given provisions. That was not dismantling. We learned from the provisions. The provisions was just a window to throw crumbs. But luckily we used those crumbs to at least gain life expectancy. But that was not reform. We now need reform because we know it's not just HIV, it's not just TB. I mean, I'm not even, TB and malaria, we are far behind. It's more, and what else we don't know in the future, that system and that regime needs to think future. These countries will need more innovation and building research and development capacity in the countries where these epidemics are hitting without having to go shop in another village, but shop in your own village.
Yeah.
And they are not making it easy to do that.
Or worse, beg in another village.
Oh, we are in a begging moment right now. The fact that there is no accord, it's creating a system that you are still going to be kneeling. That's why we have to choose HIV over TB or TB over malaria. We are still in the begging mode because the person who's offering is telling us, be content with the 60% reach. That's good enough for us. We are moving on to the next thing because we need to show our investors this is what's next. What's the most sexiest thing?
And I think this is what we will take home from this assembly, right? And it's a continuation of a bit of a trajectory that we are all on. You know, how willing are we actually to really open up difficult conversations where we have the intersection of trade, of health, of human rights, and acknowledging that the current system is not serving all of us well. It is serving some people well, and it's not serving everybody well. And I think that's where we have a responsibility as the UN to open that space and have a real conversation. Like Vuyiseka is saying, we were successful with HIV, but we didn't dismantle or totally change the system, but we created some new parts of the system, right? Some parts around voluntary licensing and so forth, and new mechanisms that we didn't have before. But it is not fundamentally questioning whether the system serves all of us well. And I keep on saying, you know, whatever we do, we need to remind ourselves, and I say that from a UN point of view, we're not the UN for some people in some geographies, right? We're the UN of all people. And so the solutions that we come up with must be for all people. And so that is a bit the moment, I think, that sits deeply with people here this week to say, okay, I don't know what the final outcome will be. The final outcome will be a postponement of a decision, right? And so we have lost that one moment where we could have all agreed this will not happen again, and here's what we're going to do to ensure that it won't happen again. But instead, we have found ourselves in a place where we are really having difficulty to fundamentally question and agree on some of the very principles that we will have to all agree on to change.
So I struggle with one thing that you've said, Chrissy, and I can't believe I'm saying this, but is the UN the place to do that? The UN is made up of member states. And someone said to me, you know, Vanuatu has the same rights, as it were, with the United States to raise their hand and make their point. Now, in practice, we all know that the states with money can influence things in a much more effective way. But nonetheless, we are talking about governments. And some of those governments, frankly, are legitimate. Some of them have less legitimacy. And if you think about the frustrations that we have in negotiating treaties, in negotiating declarations, the compromises that we have to make that are about restricting access to those groups that we don't like, we collectively, we as the governments, whether those are sex workers, whether those are men who have sex with men, whether those are drug users, and then increasingly hearing that we're calling girls and women key populations because they're in a minority. How? Why are we even thinking that?
But
Is there another way of approaching this?
But turn it on its head, Ben. So that is the half glass full version of things, right? The half glass empty version of things. The glass half full version of things is, what have we managed to push through that multi-sector, that multilateral system? Why do we have the UN? We know we have the UN. It was established after a terrible crisis in the world, right? Where we decided we all needed to have a space for all member states to sit around the table, and that in theory, it shouldn't matter whether you were rich or big. And that comes with compromise all the time. Do we need a reform, and do we need to do things differently? Possibly. But where is that space that is not just influenced by money? The only other spaces that you create will be places where somebody will invest and will create a space with money. And then it will be about the people that have the most resources will have the loudest voice. And
well,
I think,
precisely.
And I think that's why we need to do it differently. And remember, that's why I didn't say member states. I said the UN is the UN of the people, right? And it has a responsibility to bring diverse voices into those negotiations, and we need to make sure that happens.
We do. And I'm just struck, and of course you talked right over me, as you should do, as I expect. But as you were saying, if we didn't have the UN, we would rely on people who have the money, like the Davos, it's like the World Economic Forums that take place every year. Those are conversations by and for people with influence, power, and money. Well, we're coming up to the end of this time because, let's be honest about it, we're all going to have dinner after this.
Oh, yeah.
And I hope some wine. But leave us on a positive note. What makes you optimistic?
And there was silence. It's been a long week. I don't know. Do you want to start, Vuyiseka?
I think we have to take stock of the fact that even in crisis, even when there's no clarity, and right now the polycrisis creates that foggy view of the future. But I would like to believe that with all of this, it is through these moments that sometimes clarity comes, sometimes unity and the coming together of different groups that ordinarily wouldn't come. And in this case, I'm talking about some of the climate crisis, climate justice activists that would never be in the same city, same town, same room with AIDS activists. And the AIDS activists who are now having to listen to what it means to be on the margins. And now we are we are right in the back side of the room, and others are in the front side of the room, and finding those ways to connect. But I do hope that means that we are now more than ever going to make those intentional connections to build their movement, the push that Christy was talking about. We got where we are with HIV because there was a global push. We need that global push because the polycrisis is complex. And the big powers of the world are working on our fragmentation. They are using those cracks, including what we see with the Accord. They're using those cracks to deepen the cracks because we are so far apart, because we listen to these whispers of HIV time is over. Even ourselves in the movement, we listen to those whispers. And this is a reminder. What happens when we ourselves listen to these whispers is that even the very same thing we've gained can be pulled quickly. We thought COVID had whipped all of us so hard that in Accord, everybody is going to say, yes, sure, we can do this. Where where people are saying, no, we are back to square one, as if there couldn't be an emergence tomorrow of a pandemic. We have quickly forgotten. So activists have to come up in the corridors of the UN, in the corridors of the Global Fund. We need to organize I'm not saying organize only in the way of organizing civil society, only to strengthen communities, but to organize in those spaces and influence where we can in different ways, in the different spaces that we are in, because we are also part of that push back. We are part of that resistance, and not to forget and be comfortable in our privilege, sitting in Geneva. Often these conversations are happening when we are in the room, and not to forget that if in this moment we need to rise and add to the contribution of clarity in how we're going to get to the North Star, because it is through this moment where we're feeling like, But for me, it's crisis that got us where we are with HIV. We must use this crisis as fire to get us to the next level.
Yeah, I will add to that. I think, for me, this crisis, but also this moment where we are successful, that's also true. So what Vuyiseka was saying earlier on, the SDGs, we're not doing well, but we're doing well on SDG 3.3 compared to all the other SDGs, right? So that's also part of our problem, which is creating our crisis. All the others are doing even worse, but we're doing quite well. And we have a chance. We can see from our data, we could actually get there. But what we need to do now is we need to really think deeply about what does this next version of an AIDS response look like? Not just in the UN and what a joint United Nations program on AIDS looks like, or what does the Global Fund look like? No, also what does it look like in communities? What does it mean when we're integrating HIV into health system? What does it mean when we say health systems strengthening? I keep on saying people go to countries and use the primary healthcare system and acknowledge that that system is not ready to integrate HIV, right? So what are we going to do jointly? So there's a new way of really rethinking ourselves. And for me, there is a lot of people who want to do that. There is good energy to do that. And we need to help ourselves to create those spaces to think critically. All of us need to be different in that new world, right? But also, and think about going back to where you started, Vuyiseka, really be more strategic about how we intersect with others. We are in those little bubbles. We don't talk to each other. And that's why I was talking about women's health. I keep on thinking, what else could we do to be much stronger on women's health and integrate our issues around HIV into that conversation, around climate change, right? At the moment, it's all about climate change. But is that where we really need to be, is the HIV movement? I think a little bit, but maybe not. There's other ways of thinking about where do we intersect with human rights movements. What does that mean, how we organize as communities, as civil society? And maybe ending on, we're thinking a lot here about what does a new version of a multi-sectoral response look like. That's what made us successful at country level. That's not what we will be able to sustain if it's only about one disease. But what does that next version look like, right? So being open and going a little bit more back to first principles. If we had a blank sheet, what would it look like, right?
Well, we wouldn't start from here.
No.
Yeah. But so I'm going to be a little bit twee. Okay. And having the final remark. I mean, for me, what is...
Who said that we were going to give you the final remark?
Oh, well, I know.
I thought we were done.
Hello. A Shot in the Arm podcast with Ben Plumley.
With Ben.
That would be me. But I'm thinking that we have fought all these years to get women in leadership positions that are making decisions and driving change. We have... at UNAIDS, an executive director and 2 deputy executive directors that are women. We have you, Vu, now at the Global Fund. And, you think 20 years ago, we would likely be 3 white men talking. And so no pressure on you two, but I think you are the champions of making us develop new solutions and being willing to take risks. And frankly, your time is now. So that's what I get. That's the good kick I get out of this.
We take the marching orders.
Thank you. Well, with that, just to say a huge thank you. I know it's the end of the week. Not quite, but almost. Well, that's it for this episode. And in fact, that's it for A Shot in the Arm at the World Health Assembly. We are signing out, over and out. A quick thank you to Newsdoc Media, Erica Spera, and our colleagues here who have helped us record and produce these live streamed high quality episodes, which is a former guest, Elisha Dangeorgiou, said I couldn't do on my own last year, and she was quite right. I can truly say now, have a great week and a safe week.